Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Hello, everyone, and welcome back to the special edition of This Just In Radio. I'm your host, Justin Barnes. Today, we're broadcasting live from HIMSS25 in sunny Las Vegas. Very excited to be here. It's already been an action-packed 72 hours. The HIMSS annual conference is always a centerpiece of my annual schedule, and this happens to be my 25th HIMSS annual conference and my 11th year broadcasting from the annual conference. I feel very fortunate to be able to broadcast annually from HIMSS. Hal Wolf, Albie Zakes, Morgan Searles, and the entire HIMSS team have been extremely supportive, and I'm extremely and tremendously grateful. Also, I can make a special note of thanks to Roberta Mullen, Greg Masters, Carol Flagg, and the entire Healthcare Now radio team for their tremendous support and managing the demands of my HIMSS broadcasts annually and the recordings. Also, I'm eternally grateful to all of my hundreds of guests throughout the years, and certainly to all of my loyal listeners. We owe all of this show's success to you, and we still are so honored to have won the Sway Health 2024 Healthcare Podcast of the Year award that never gets old, but rather challenges us to get better every day with every broadcast and every conference. Which leads us to today. This is the start of 3 days, 5 shows, and over 40 guests here in Las Vegas for HIMSS25. We have our best lineup yet of CEOs, CIOs, CTOs, care providers, researchers, policy leaders, and visionaries joining the show. As many of you know, my goal for broadcasting live each year from these key conferences is to create an information medium that shares best practices, key strategies, and actionable intelligence from the industry's leading sources and experts. My objective, along with all my guests here, will be to offer tactics and strategies to not only survive, but to thrive as you navigate your hospital, your physician practice, your company, or even your family through all these changes occurring across healthcare today. There is more opportunity than ever before for all of us to thrive, but we must understand how healthcare is evolving, how policy and reimbursement is shifting, and where best practices and innovation can support our efforts. I hope you glean all of this over the next few days. That's at least my goal. Welcome back to This Just In Radio Show, broadcasting live from HIMSS25 in sunny Las Vegas. I'm very excited to introduce my next guest and new friend of the show, Mike Kirchhoff, Chief Innovation Officer, Patient Safety, Cooper University Healthcare. Welcome to the show, my friend.
Yeah, thanks for having me.
Fantastic. When did you get in town?
2 days ago.
2 days ago. And it's been a great show for you so far?
Oh, yeah, fantastic. I mean, it's slick. It's well organized. It's been fantastic meeting a lot of folks. Yeah. I always judge these things on, how many new contacts I make and action items I get to take home with me. Yep. So they always make work for me, but I figure if my organization is going to spend the money to send me, I better bring value back. Yeah. And I'm certainly getting a lot of that here.
Well, your attitude's fantastic because I completely agree with you. So many people come in. I like to say, if you don't have a successful HIMSS, that's on you. That's you did not either plan or hustle while you're here, because everything is here. Every thought leader is here. Every innovation, opportunity, work group, anything you want to learn, you can learn it here if you make the effort.
No, absolutely. So. And I haven't even been on the floor. It's been more learning in the sessions, et cetera, and a big, exciting time at the Emerge stage early on. So that was great program. Really learned a lot about what the C-suite's thinking about next steps for healthcare, et cetera. Really a lot of actionable information there.
So where's Cooper University Healthcare, and where are you based out of?
So we're in New Jersey, southern New Jersey, Camden City.
Sure.
So right across the river from Pennsylvania and Philadelphia, but definitely an inner city, under-resourced population. So that's why we're talking about social determinants of health.
Yeah. I love social determinants of health. That's how you got on my show, because that's been a big pet project of mine for the past 10 years or so. So I love what you're doing there. Thank you. So we'll certainly talk about it. What progress, I'd like to start off my show with something positive. What progress are you most excited about seeing in the industry today?
Couple things. One, a lot of standardization. So as we're identifying best practices for communications, interoperability, et cetera, we're seeing more and more groups step up and sort of standardize that. So it makes it much easier on the patient safety side, which is another one of my hats. The more standardized things can be, the less likely something's going to go wrong. Absolutely. Or when it fails in a way that's safe. Yep. So standardization, interoperability, while these things have a long way to go, I'm very heartened by how much progress we're making every year and how much the folks on this floor right here are working together to make interoperability, good communication. It's so so important.
Love it. Yeah, actually, you have a cool role, Chief Innovation Officer and Patient Safety Officer.
Yeah,
So-
I mean, essentially, we did that on purpose. When every organization is going to stumble and fall, healthcare at the end of the day is a human endeavor. Humans will make mistakes. When we identify those mistakes, that's an opportunity for us to do better next time and create value not only for our organization and our patients, but potentially spin out new ideas, new workflows, new IP, new companies, etc.
Yeah. Love it. Great perspective. What are you currently working on that you're most passionate about?
Well, just finished that one up. So Social Determinants of Health Hackathon is our second year that we're doing it. Basically, in the Innovation Center, we sort of have these three goals. One is to bring value to our organization, our community, by doing commercialization of our own internal IP, which is important, and I like that. And it gives us an opportunity to create value and also revenue stream, which is important as a not-for-profit hospital in an under-resourced area. We need those revenue streams to really get the technologies that we need to best care for our communities.
Right.
And this is just another way to attract really good talent and create value, and to teach entrepreneurship, and to also bring in new technologies through partnerships. But as we were doing more and more of that, we were realizing that, well, what's a way that we can further accelerate our own intellectual property generation and get people excited in the community about generating their own intellectual property and entrepreneurship. So this idea of this hackathon was born.
Right. And this hackathon real quick was in New Jersey or here with under HIMSS auspices?
So both. So what's
Okay.
really nice about it, and a big shout out to HIMSS and the HIMSS Foundation and Dana Castro. We did, it wasn't like a regular hackathon. It's over 2 weeks, and I'll talk about that in a second. But then we had we had 30 teams, ultimately down to 12 pitches, 3 winners. Those winners then pitched on the Emerge stage yesterday.
Okay.
So that's
here
why
in Las Vegas.
Yep.
Okay.
And then HIMSS was further involved. What we're really trying to do is not only get IT and coding professionals, but folks that are caring for communities, social workers, etc., or folks that just have an idea. And what the HIMSS Foundation also got for us is scholarships for CA HIMSS certifications for all the participants, so they could get trained up, get those micro certifications, get a living wage, and then participate in really creating the next solution or implementing the next solution that's going to keep communities healthy.
Yep.
But specifically, we were interested, as being an inner city hospital, these social determinants of health, we see that our patients, their outcomes are more driven by their environment than their own physiology and genetics.
Right.
And we wanted to get teams to think about that. And the way we did that is we instead of doing a standard hackathon over 48 hours and just kind of creating an MVP, a minimum viable product, we did it over 2 weeks. And we have this mantra of learn, hack, pitch. This idea that we're going to get social scientists and computer scientists and data scientists together. Those social scientists, those actually doing the patient care, those actually out in the community trying to remove barriers. They know what the problems are. And the social scientists and the data scientists, the computer scientists and the data scientists, they have the solutions, but they don't know what the problems are. Get them together, get some social entrepreneurship at that intersection there. Teach them. If you're a social scientist, teach you low code, no code. If you're a computer scientist, teach you code first environments and get your game up, and then get those computer and data scientists, teach them the social aspects, teach them about social determinants of health. So they're learning, and then train both groups. How do you get money for your idea? Teach them entrepreneurship. So that's the learn. Then they hack, create some concept, get me a wireframe, get me some minimally viable product, build it out in an environment that we provide. We had great partners. HIMSS helped with that. Microsoft helped with that, really building out these environments, data sets from the CDC and our NJ-HIN through the NJII, really great ways for people to get roll up those sleeves and do the data, and then pitch. Actually try to get this idea to get money, to actually create the value, because you can have the greatest idea in the world, but if you don't create a company that actually brings it to market, you're never, ever going to improve someone's life.
Make a difference.
So that's why you learn, hack, pitch, and that's why we do it over 2 weeks. And we're going to be doing it again next year. So if anybody's interested, we're going to be looking to also spread that out other places in New Jersey, other states. HIMSS again has been a great partner there, helping us meet with folks to bring this idea of workforce development also.
Absolutely.
And training the IT side and getting those micro certifications so that folks can get the workflow, come to HIMSS, get their micro certifications, work their way up, right? It's a great, healthcare IT is one of those things that is a great opportunity for so many folks. getting those micro certifications, getting in an entry level, getting a living wage, getting your health insurance, but then also many organizations, ourselves included, have lots of programs for folks to get extra training, et cetera, and they move up that ladder, get better pay, get into manager positions. So we really see this as a way to get people excited about healthcare IT, but also excited about finding solutions for those communities that need it most, and lastly, help them improve themselves by getting a job that has a living wage and lets them work their way up.
And anybody can participate in that anywhere, not just in New Jersey?
Correct.
Okay.
Yep. Yeah, we had teams from California, et cetera.
Good.
We had an international team. What we tried to do, we called it the New Jersey Social Determinants of Health Hackathon because we're using New Jersey specific data. We like granular data, but we find that you might be able to use hyper-local data and hyper-local solutions, but those solutions often are transferable to other cities. What works in Camden might work in Newark, New Jersey, might work in Detroit, might work in anywhere. So, and then that's part of that entrepreneurship, helping people do the market analysis and understanding what that total obtainable market is, not only for Camden or New Jersey, but the US or the world.
Right. So I want to take a little bit of a step back because it makes complete sense. And that's why social determinants of health has always been, again, in the forefront of my life, at least for the last 10, 12 years or so. But you brought up a good point is your social factors and your community can basically, most people think about our genetics, and that's our future and that's our health. But when so the way you put it, having your local social geography can make a very big difference in that when that goes kind of against traditional thinking. So
80% of your outcomes are determined by your environment, and that's, do you have access to food? Are you exposed to violence? Do you have stable housing?
Right.
That's far more important than your genetics and whether or not you're going to have a heart attack or stroke.
Right. Yeah. That's significant. Looking into the proverbial crystal ball, what do you see as a strategy or trend that we need to be ready to navigate in 2 to 3 years from now?
More on the social determinants of health side, the more we can focus on getting the resources to communities that need that the most. And it's cost effective too. When you look at total cost of care and where you're going to spend your next healthcare dollar, spending it with folks that have specific needs or are lacking in social determinants of health, that's a dollar best spent, because those are the ones that are going to have the better outcomes and overall reduce our total healthcare spend, have healthier communities, et cetera. So really not just thinking about patients generically, but also thinking that there are healthcare inequities, and to make a system equitable doesn't mean everybody gets the same resources. It means some people need more resources. And being intentional about that healthcare dollar spend to those that need it the most, in the end, will reduce everyone's healthcare spend because we have better outcomes. Right.
Nope, I love it. And you're going to get the gold star because you have not mentioned AI one time on this show. And you're the first person I love the problem. I love AI. I mean, I'm knee deep in it in a lot of ways. However, you didn't mention it on air, so you get the gold star for that.
Awesome.
We're going to make sure we make it.
You didn't mention blockchain, so there you go. That was 2 years ago.
Exactly. Good point. So what were some of your, in the closing minute or so, what are some of your goals? Did you achieve your goals for your HIMSS or anything else that you want to achieve before you leave town?
Oh, no, I definitely achieved my goals. One of my goals was to get on a good podcast. So here we go.
There you go.
And to meet a bunch of folks. So met a bunch of folks, but I have another day here. So I'm going to go above and beyond, but very excited, very happy with the conference, very happy with what we get done, and very happy with the success of our New Jersey Social Determinants of Health Hackathon. Second year. Got
Congrats.
3 great teams here, got lots of great feedback about that, and getting people excited about helping us lift 2 and 3 and 4 and really talk about that learn, hack, pitch sort of idea, and getting people trained up in the area they need most so they can create the solutions of the future for the communities that need it most.
Yeah. Well, you achieved your goal. Congratulations. You actually got we got podcast of the year last year in healthcare, so you got to kind of put on a good podcast. Is that Dana Castro you said?
Yes.
That's congratulations. Very, very cool.
Yeah, she's awesome.
Yeah. And when do you leave town?
Friday.
Friday tomorrow? Yeah, so do we. Going back to the East Coast, going back to Sarasota. But I actually grew up going to Cape May, New Jersey, so I have a sweet spot in my heart for New Jersey as well.
Yeah, it's very nice. A beautiful shore town.
Yeah, very
cool.
Love
that.
Yeah. Well, safe travels back home. Thank you so much for joining us on air. You're welcome back. So let's make sure you get on here next year too for your hackathon.
Oh, for sure.
Love what you're doing.
Yeah, absolutely.
Appreciate it.
Love to talk about it.
Absolutely, my friend. Thank you so much.
Thank you.
All the best. Thank you. Safe travels. Welcome back to This Justin Radio Show, broadcasting live from HIMSS25 in sunny Las Vegas. Very excited to introduce my next guest, and great friend of the show and a great friend of mine, Ashwini Davison, CMIO Oncology with AWS. Welcome to the show, Ashwini.
Thanks so much, Justin.
Or
Great
Dr.
to be
Davison.
here.
You're awesome.
Ashwini is great. No, thanks so much, Justin. Great to be here, and what an exciting time.
It is, absolutely. I assume you've had an amazing few days here in Las Vegas so far?
Yes, I really think that one of the highlights for me so far, Justin, has been that thought leadership dinner.
Absolutely.
That you got to really be a part of as well, where we're meeting with strategists from health plans and foundations, IT organizations, all about how we can do better by infusing AI into the cancer patient journey.
Yes.
That was really inspiring yesterday.
It was, and I actually brought it up in my pre-air motions and discussion actually with Roberta, my producer. I actually brought up some of the components from that and the exciting aspects that we discussed. Actually, why don't you take a second to talk about what you were most excited about last night before we dive into the show, because we got a little time here. So yeah, what did you love about last night and that dinner?
I think what's so important in this time period where we're all aware of the importance of being efficient and trying to find ways to automate and collaborate, what I enjoyed most about the conversation, Justin, was that we had public-private partnerships
Absolutely.
that currently exist, whether it's between AWS and a health system or AWS and our expansive partner network, but they were all in the room together. And that's going to increasingly be important. I think I started off last night, right, with that quote from JFK, which is, "Rising tide lifts all boats."
Absolutely.
And
love it.
There's momentum here, and we all have to lift each other.
Very true. And you also brought up the call, we need to standardize more on FHIR, correct? Give me 10 seconds on that or 15 seconds on that, because
Absolutely, happy to. So FHIR is a standard that we have really worked on increasing adoption of, and especially with the Children's Brain Tumor Network. This is led by Adam Resnick at the Children's Hospital of Philadelphia, as well as Jay Storm. CBTN is a 35 multi-site consortium, and their goal is to find cures for pediatric cancers. To do that, we really need near real-time data access, and FHIR with AWS Health Lake integration is really one of the standards that we're testing and promoting, and really feel optimistic that we're going to be able to get there to help children.
Love it. And so I brought up that, before we went on air too, just because obviously importance. Actually, one of the fathers of FHIR will be here coming up next, Anish Chopra. So I love it. And I want to make sure we keep talking about that and pushing that, because it needs to be a standard that's adopted much more broadly.
Yeah.
And we're getting there.
I'm so glad that Anish is here. He's been championing this for so long, and the journey that him and his team have had with Care Journey and then with Arcadia, really impressive work. And again, he's another great advocate for public-private partnerships.
Absolutely. That's how I met him, the first time I ever met him. So what progress are you most excited about seeing in the industry today?
I think that what I am really excited about, Justin, and you're seeing it this week, is the emphasis on multimodal data. It's so important. We have to be able to see the full patient, right? We have experience with electronic health records. We know the importance of that clinical record, right? We can host EHRs on AWS.
Yes.
That's great. But the other part that's so important, especially in oncology, the imaging data, the genomics data, that, spatial transcriptomics, digital pathology, and that's something that the conversation, it's now infused into the broader conversation.
Love it. Totally agree. And you talk about a little bit, as you started here, but what are you most passionate about that you're currently working on?
Thanks for asking. I'm thrilled in the new year to be asked by our AWS healthcare leadership to focus on our strategic initiatives in oncology. So in my role, I am leading the charge from the AWS side with our involvement with the Cancer AI Alliance. You may have seen the announcement from Matt Garman, our CEO, at the end of 2024 that AWS has invested $10 million to support it, with 4 NCI cancer centers to start, Fred Hutch, Dana-Farber, MSK, and Johns Hopkins, but really with the goal to expand to the other NCI cancer centers. And what I think is so important about this initiative that I'm really looking forward to advancing quickly with the teams is that it focuses on, as Jeff Leake from Fred Hutch would say, sharing AI insights without sharing patient data.
Right.
So important.
Love it. And how many sites are there? There's 37. How many sites are there
Great question. So the initial cohort for Cancer AI Alliance, KAIA, is for cancer centers. But then ultimately the goal would be to expand to the other, there's a total of 57, let's say, comprehensive cancer centers.
Right.
And then ultimately 70 NCI designated basic clinical. But really, right, and I think where you're getting at is to move the needle, to really help the larger population. There's 1,000 cancer centers, even without National Cancer Institute designation. We have to make those insights available to them.
Absolutely.
And that's part of the ethos from the get-go. How can this scale?
Yeah, love it. And I think I kind of know some of this, but what are your goals for HIMSS25 and what do you hope to achieve over the, I mean, you've already achieved a lot in the last couple of days. I know that was part of some of it, but over the next couple of days, what else do you want to achieve while you're here?
What I really want to achieve, Justin, is making sure that others who are here understand how much we are diving deep, one of our leadership principles, into the cancer center space to support patients, providers, and the population. And that means not just focusing on the data, but the strategic public-private partnerships.
Absolutely.
Figuring out how we can support with diversifying revenue streams to kickstart this, right? So it's not just about the government, but what can we do as an industry, and what can we do to have philanthropy kickstart certain efforts? They play a really important role and are passionate. And so I was just with the Pediatric Brain Tumor Foundation the other day, and we'll be meeting with Breakthrough Cancer, in a few weeks. Those foundations and the nonprofits play a big role in advocating for change, and we have to let them lean in with us.
So let's be saying something inspiring, because I was inspired by some of the conversation last night at dinner, but I think for my listeners, certainly who are patients, I mainly health systems and thought leaders listen to my show, but there's also a handful of patients out there that listen to my show, and we're all patients in our own right. What can we look forward to over the next couple of years? And this is not necessarily following the questions of my show, but more of inspirational, what people can look forward to in cancer treatments and how we can bring treatments more quickly to bear and more quickly to market because of Gen AI. Talk a second about that.
Yeah, that's a great question, Justin. And I want to share that some of the passion that I have and the involvement that I have is because of the patients and the patients' families who understandably are mad, right? There has not been a cure or a treatment for DIPG, diffuse intrinsic pontine glioma. We don't have a treatment. Expected survival is less than 9 months. That's no different from the 1960s when Neil Armstrong's daughter passed away. And some of the mothers who have lost their children to DIPG are the ones that have taught me the most about how we have to go beyond the technology and really focus on the partnerships with the data to leverage AI to find some of those patterns. And that's a lot of what we're doing, whether it's with Amanda Haddock and the Dragon Master Foundation, Lisa Ward and the work she's leading with DARPA. What we really want to do is, it shouldn't take weeks, right, to get the results to an analyst or a researcher. This needs to be near real time so that we can apply those AI insights and perhaps even expand into N of 1 clinical trials.
There you go.
Those are some of the really important needle-moving initiatives that we're working on with pharma, health systems, and AWS.
I love it. Excellent. So look into the proverbial crystal ball. What do you see as a trend or a strategy that we need to be ready to navigate in 2 to 3 years from now? I know it's a big question because we're actually even with Gen AI, things move very quickly. However, what do we be ready to navigate in a couple of years from now, do you think?
Yeah, I think that's a great question. And what I will say, Justin, is just during our podcast alone, every 30 seconds, there's been a new patient diagnosed with cancer, right? So we have to move fast, and our cognitive capacity alone isn't sufficient.
Right.
We have to apply AI, not just in diagnosis, management, and treatment, but really in moving upstream. How can we prevent? What are those additional factors? And data's not the issue, right? There's an abundance of data, but harmonizing that data, getting it in a way that we can apply, that is AI ready, that's so important. And I think especially with the executive order, right, focusing on making America healthy again, there's such a huge emphasis on children, but moving upstream to cure, to prevent,
Yes.
rather than just focusing on sick care and curing.
Yep.
I think that's where we have to move the conversation as well.
Love it. Dr. Davison, in the closing minute here, what do you want to see maybe from almost as a challenge to the industry? I mean, what can we do as an industry? Say, hey, Justin, if these thought leaders or these people can get together, these organizations, what would you say is a challenge to somebody to say, I want more progress here, or I challenge the industry? Because I know I do that from my perspective when talking to back in the day with EHR companies. I would always challenge them to get better, make it more usable, more focused on the clinician, less burden areas. Well, is there a challenge that you might put out to people?
Here's the challenge that I would put out, and I think yesterday's dinner was really a start to that. Please embrace the partnerships and let us know what you have out there. There's some amazing innovation, right? We had some brilliant chief innovation officers in the room. We had a former, Secretary of Health for a state.
Yep.
We all need to be sharing the innovations that we have so that we can get to a space of efficiency, right? We have to bring those ISVs, the independent software vendors, together with the SIs, our system integrators. And that's where the APN, the AWS Partner Network, can play such a tremendous role in bridging those gaps, connecting the dots, because we can do better together.
Absolutely.
And we can lift all boats, but we need to know what's out there. The innovation's there, bring it to us. We want to know what's happening so that we can prevent others from having to reinvent the wheel in a time where automation and efficiency is top of mind.
Yeah, I love that. Congratulations there. And I will say the energy in the room last night and the collaboration that you have and the way people work together and just the way they treat each other is inspiring. And so that kind of left the dinner last night, just seeing that kind of collaboration, energy, and individual thought leadership was unsurpassed. So all is phenomenal.
Thank you so much, Justin.
And we see the umbrella that AWS puts out there for everybody, and you give us this great collaborative platform as well. In the closing seconds, is there a partner or two that you said, hey, these, that you love or you would love to highlight for a second? These seem to always go above and beyond or work a little bit harder than anybody else. Not, anything like that?
What I will say is we have, some tremendous partners in the imaging space and the digital pathology space. And yesterday you saw we had, the CTO from Proscia there, and
Yes.
they are doing some wonderful
Phenomenal
work
growth
in
great.
digital pathology and supporting, patients with cancer. From
Yes.
the system integrator side, Citius Tech, the Vice President John Mamarian was there, an expert in imaging informatics, oncology informatics, and then also on the ISV side, what I'll really say is there's some emerging startups and spin-outs on AWS that folks should keep an eye out for, that you'll be hearing about in the next few weeks and months.
Very exciting. Dr. Davison, AWS, thank you so much for joining the show.
Thank you, Justin.
Appreciate you. We'll see you soon. Thank you. That's a wrap from Las Vegas and HIMSS25. Thank you all for listening. Thanks to everyone who voted us 2024 Healthcare Podcast of the Year. Thank you so much, Roberta Mullen, Greg Masters, Carol Flagg, and the entire crew at the Healthcare Now Radio Network. They've also been producing my show for 11 years. Also, a special note of thanks to Jake Reed, my head of media, and certainly a big thank you to Hal Wolf, Albie Zakes, Morgan Searles, the entire HIMSS team. They're always extremely supportive in the events and broadcasting requirements that I have. And again, thank you so much to all my listeners. We're grateful for you. You make us better with every broadcast. And that's a wrap from Las Vegas. Have a great rest of your day, everyone.